Atrial fibrillation is a common condition. As much as 6 million Americans are diagnosed with this type of abnormal heartbeat. This Heart Health Month, we take a look at a new device that's changed one man's life. Jim Pritchard tells us his heart used to beat more than twice the normal rate, as much as 225 beats per minute. Take a look.
It's uncomfortable. It can last anywhere from a second to an hour. Your heart is out of rhythm, you shortness of breath, headache, lightheaded.
Telltale symptoms of atrial fibrillation. Pritchard was hospitalized for a week and placed on several medications for nearly a year because he was at a higher risk for a stroke.
When the heart is not beating regularly, when it's fibrillating, then blood pools and clots can form, and then those can travel to the brain and cause a stroke.
Like Pritchard, many with what's called AFib are placed on medication or they undergo a procedure called ablation. Doctors use lasers to burn tiny areas in the heart that are sending the abnormal electrical impulses, triggering the rapid heart beating. But ablation isn't always successful.
It's difficult to take the catheter and move it to each location and make each lesion adjacent to the previous lesion. You know, this isn't surgery, so we can't see what we're doing.
But a new device approved by the FDA, the CardioFocus HeartLight catheter, gives cardiologists like Dr. Vivek Reddy sight.
It's a balloon catheter, so it's introduced into the heart, then it's inflated with saline, and we push it up against the vein. There's a camera at the back end of the balloon, as well as light, so we're actually looking at the tissue that we're going to ablate.
In a clinical trial, Reddy and his colleagues found the HeartLight was easier for doctors to use. The results for new users were just as good as traditional ablation methods, which doctors had performed for years. Pritchard took part in the trial and saw immediate results.
I was cured. It really, there was no rehab, no follow-up.
He's now breathing effortlessly, no longer on any medication. A promising advance for a problem millions more Americans are expected to develop as the population ages.